So I want to start with the big question for me and probably our viewers as well. Um, there's new guidance from the
Yep.
CDC on vaccinations for children, and it's dropping the recommended vaccines from 18 to 11.
Yeah.
How could that impact Lane County?
Well, it doesn't impact our recommendations because we follow the West Coast Health Alliance, which has not changed. We are still pursuing the same guidance that we did last year, year before that, year before that. And that guidance is really designed to try and reduce ER admissions, to increase healthy kids at school, and generally to pursue population level health. And we believe that American Academy of Pediatrics, the Oregon Health Authority, and the Washington State Health Department really understand what it takes to do that. I don't think we are looking to poke holes in the federal guidance or comment directly upon that. But we do believe that the West Coast Health Alliance has our best interests for Lane County in mind, and really that's staying the course when it comes to childhood vaccinations and the requirements around vaccinations for school-age children in Oregon.
And so Jonathan Modi from OHA emailed me this morning saying that schools are required to follow the Health Alliance.
Yep.
So pretty much we won't see changes to students going home. They're going to have to stick with what's required for
Yes.
parents to do for their kids.
Yes.
Do you think, though, let's take COVID and flu vaccines, for example,
Yep.
they fall under for the CDC's new guidance, they fall under that parents and doctors conversation,
Yep.
not universally required or anything
Yep.
like that. Do you think parents will lean towards not doing it at all now that it's viewed that way?
I really don't know what parents are going to do. I would suspect, and this is probably something that I maybe shouldn't say, but I suspect that the decision might have something to do with their political allegiance, unfortunately, when it shouldn't. Really, this is a decision, and we're not against the vaccine recommendation of having a conversation with your provider. Because I think if you look back through your archives of every time myself or Dr. Ludke or anybody from Lane County Public Health has come on and talked about vaccinations, we have our general recommendations that we make for the whole community. But, and there's that big asterisk, but always have a conversation with your provider, especially if you're in one of those groups where the recommendations might be not be super clear, or they might not be consistent 100% of the time, or if you have a pre-existing condition, or if you're immunocompromised. All those things we say, please, first of all, develop a relationship with a primary care provider, because we believe the people that live the longest in the United States, that's the first step, is having a primary care provider. However you choose, whatever degrees that person has, it doesn't matter if it's a nurse practitioner, a nurse, a doctor, whoever it is, have someone that's looking out, besides yourself, looking out for your health, and have that conversation about what vaccines you or your family should receive with them. There's nothing wrong with that. And I think that that's what you'll find, uh, the kind of embedded within the West Coast Health Alliance recommendations, and certainly at Lane County Public Health, is we're not trying to pull the wool over anybody's eyes. We want you to seek as many different opinions as possible. We want you to read as much as you can on the subject, especially materials that come from peer-reviewed double-blind studies that take the time to really look at safety and efficacy. And unfortunately, the rush to approve a vaccine for COVID during the pandemic has colored people's perception around vaccines that we have 60 or 70 years of evidence on. We have so much data on MMR, on some of these other vaccines. And so to call that into question, all that data, all that is we believe is a little short-sighted, and we're going to lean on what we know, what we can put our weight behind. And we urge parents to do the same, especially now that we're seeing a rise in measles cases across the United States, especially since we have physically seen the impacts that communicable diseases can have on our communities. Let's do everything we can to prevent them as parents, as community members, as people who just want to do the right thing. And sometimes that means getting a vaccination. Sometimes it just means good respiratory hygiene. But the thing that we're pushing on people, if we're pushing anything, it's to make intentional decisions. It's
Yeah.
not necessarily to or to not get a vaccine. It's to make good decisions with lots of thought.
And you mentioned the rise in measles cases across the country, and
Yep.
Linn County had two cases, the first of 2026 now.
Yep.
How vulnerable is Linn County when it comes to measles?
That is a fantastic question, and I can tell you what we know. The true vulnerability, I think, is somewhat more nuanced. Of all of our school age children in Lane County, 88% have received the MMR, the full MMR series. We need 94 to 96% of those school age children having received their full series to be protected against an outbreak, to be protected against, kind of rolling cases. Now, that 88% puts us in a better position than, say, Texas or Utah or some of the other states that have seen double-digit cases. So we can feel good that we probably won't see a massive number of cases. However, because we are lower than the needed percentage for herd immunity, and because measles especially has such a high R rate or reproductive rate, one case typically causes 16 cases in an unvaccinated population. We are susceptible. We are susceptible to potentially a pediatric death. We are susceptible to far more cases than we would like. And even though this wasn't your question, I think it bears reminding that a measles case does not only affect the child that who is infected, it affects the entire family. Each one of those people is going to be a contact, is going to be asked to stay home from work, is going to be asked to stay home from school. They're going to have to care for their loved one who is sick. It's a big, big cost to their life. And so again, it comes back to the question, should we do everything to prevent these illnesses if we have the tools to do so? And the answer from us is absolutely yes.
When we're talking about risk factors, some parents may not know, they decide I'm going to get my child exempted from these vaccines, but they don't know that their child might be actually high risk. How can a parent determine or know if their child is high risk?
That comes back to that great advice of having, first of all, get a great relationship with a primary care provider, a pediatrician who's going to get to know your children, who's going to take the time to really understand them and what their needs are, get them tested for everything they can possibly be tested for so we understand what their medical portfolio looks like, and then have a conversation with them. There's nothing wrong with consulting your primary care provider about these kind of decisions and trying to ascertain whether or not your child is in an at-risk group. I mean, we can do, for different respiratory diseases, we can talk about the risk factors of children or adults who have pre-existing conditions. Especially in kids, asthma is one of those ones that can make influenza, pertussis. Even measles sometimes has upper respiratory manifestations. It can make it far worse. And then, kids, and that can affect your decision to get immunized or not, and then also, your immune system and how it works. Um, Typically, very young children have an immune system that is what we call naive. It has not experienced enough interaction with various bacterias and viruses to really be knowledgeable. That's where vaccines come in. As we get older, we get more and more exposure to that. Sometimes we don't even get sick from it, but our immune system is still learning, and that helps. So when we think about who's probably not at risk, it's those healthy 18 to 55-year-olds, their immune systems is still firing on all cylinders. As you get older, then your immune system, like everything else in your body, and I certainly know this, starts to break down. It starts to, entropy has a way of doing its thing. So your immune system is not exempt to that. But for kids, there are kids who are either on medications or have an illness, a condition that makes their immune system not function the same way everyone else's does. And so understanding that is incredibly important. And only a relationship with a primary care provider can really get down to that. We encourage parents, if it from everything from a behavioral health issue to a physical health issue, please consult the advice and expertise of an expert. Online diagnoses are rarely accurate and rarely take into consideration everything that something might be. And that's where that second set of eyes and expertise really comes into play.
Are there any concerns here in Lane County that because of these changes from the CDC that demand will change for vaccines and that means maybe doctors' offices will order less doses of a vaccine?
Sure, absolutely. You know, any decision that we as human beings, as adults, as tax-paying adults make, where we fundamentally do not understand all the science. I don't. I'm not a medical doctor. I'm not a vaccine specialist. You don't, as a reporter. We can try our best, but we don't have the level of expertise, and yet we're asked to engage in these practices, whether it be vaccination or taking a medication or surgery, whatever the recommendation is. I feel a little bit of hesitation when I'm asked to make a repair in my car or some sort of service that I don't know for sure it needs, right? The same thing goes for our body. So we understand and predict that people, if the federal government, if the Center for Disease Controls comes out and casts doubt upon an established medical practice, there will be people who take that and question. That questioning is not bad. We live in a country and in a society that encourages questioning the status quo. That healthy discourse is part of what makes our existence so tenable. Um, and you can see that from social issues to science. Just because someone else says it's the case, don't take it for face value. Look into it. See if other people are saying the same thing. And we encourage people to do that about this issue, about vaccination. But in the meantime, while you're doing that research, why don't you do the things that you don't have a problem with, like disposing of your Kleenex in a proper receptacle and washing your hands a lot, and making sure that you stay home from work if you feel sick. We unfortunately the thing that we really want to sort of rally against is this idea that we should just throw caution to the wind and not do everything we can to prevent illness, right? Vaccination is one tool within that. But the mindset that these diseases and these conditions are worth preventing, I think we can all get behind that. Let's stay away from this idea that we're all just going to go get sick and that's going to educate your immune system. Your immune system is educated by just walking through the streets of Eugene, by just going to your jury duty or your job. You're getting viral particles, you're getting exposure to the things that your immune system needs to train itself. You don't need to go get measles on a popsicle stick to get that. So I think just really being informed and seeking out good opinions and lots of opinions is what we encourage.
I want to touch on flu
Yeah.
before I end my interview with you. How is Lane County looking as far as the flu is concerned? I know we're in that high category as far as the flu map. Um, what exactly does it all mean?
Well, we are quickly approaching our peak for the influenza season, right around January 20th every year. So, really close to MLK Day is when we typically see the highest number of influenza cases in Lane County, historically. Now, it can err on, a week or two on either side. And sometimes we get what's called a bimodal peak, where we're seeing numerous peaks within a year. This year so far, what we're seeing is a steady sort of increase. And we believe that in the next couple of weeks, we're going to see the most cases. And then we're going to see a decrease. That decrease takes about 3 to 4 months to complete. And then we're out of the flu season, usually in May. So that's where we're at right now. In terms of how we're doing, we're tracking pretty consistently with the last 5 years in terms of number of cases. In the early part of this season, we saw proliferation or a large number of H1N1 cases. That's really good because our bodies are used to H1N1, right? I mean, the first big outbreaks were back in 2009. It was circulating in our country before that. So most people's immune system are pretty familiar with H1N1. H3N2, which is also a type A, not as much. And that's why you see more hospitalizations, you see more severe flu, and that's what's circulating right now. H3N2 has replaced H1N1 as the dominant strain in our community. Um, in terms of Where we're at, I talked about the last 5 years and how we're tracking. I would say where we're at right now is if you drive out to Florence 5 times, that little road trip out there, and for the last 4 years, you've worn your seatbelt. This year, we're driving out, we're not wearing our seatbelt. So the same risk factors are there in terms of number of cases, but we don't have adequate protection. The reason I say that is we're about 62% lower in terms of our vaccination rate for adults receiving the influenza vaccine than we typically are. We usually like to see about a 42 to 50% vaccination rate. And of course we'd like it to be higher. Right now we're sitting at about 26% of our Lane County adults. And the majority of those individuals are 65 plus. Which if you look at the way these numbers play out, that's a problem because who has the most physical contact with other people? School age kids. They're super low. Who is second to that? It's people who have a 9 to 5 job, right? Who are rubbing shoulders with other folks. That's not the 65 plus crowd. So the 65 plus crowd, the most protected crowd, they're getting protected because their health depends on it. But those folks who are responsible for the spread of the flu are not getting vaccinated. And that's concerning.
Is there time for people to protect themselves from H3N2 if, or a way, I should say, more than time, if the vaccines that have gone out were designed weren't designed for this strain?
Yeah. So this is where messaging for public health and around vaccine science is incredibly hard. Let me tell you, because it's not something that you can explain in a minute and a half news story, unfortunately. But the way the vaccine works best is if we take this vaccine strain, we kill it, and we throw it into your body, and there's enough DNA in there for your body to recognize it and create a mount of defense against it. That's the best case scenario. It's not as effective if we throw strains into your body, dead strains that aren't a perfect match, but it still helps. So it's like seeing a big stop sign in English and then seeing a big stop sign in Spanish. You know for certain that you're supposed to stop when it says stop in English, right? If you're an English speaker. If there's a big old red octagon with white lettering, you probably think, I should stop, and you're going to slow down at the very least to that sign. Same thing with a imperfect match to the vaccine. Your body will still recognize H3N2 as a threat. It won't be as good if it was a perfect match, but getting the vaccine helps your body recognize that this thing coming into it has enough of a match that we should probably fight against this. It might take a little bit longer, so you might develop a few more symptoms than you would if it was a perfect match, but you're still definitely going to experience a much more mild flu infection than had you not received a vaccine at all. And obviously, there's still pretty good chance that your body's going to fight it all together and you're not going to get sick. So vaccination still a good option, even if H3N2 is not the primary vaccine or virus included in this year's vaccine? Yes. Is the timing still great for you to get the vaccine? Absolutely. Like I said, we have about 4 more months left of the flu season. It takes about 2 weeks on the high end for your body to mount a defense against influenza after receiving the vaccine. So 2 weeks, and then you've got 3.5 months of protection. So definitely still a legitimate way for you to protect yourself and your family and your community. Other than that, and if you don't make the choice to get the flu shot, still do that other stuff. Still help us prevent it. Still stay home. I mean, that's the big one. Gosh, if we can get to a place where it's not tough to go to work sick, that would be fantastic, right? Because it's still a thing. Like, oh, I'm sick, but I can do it. Oh, good for you. I appreciate you coming to work sick. No, no, stay home. The best thing you can do for your job, even for your employer, for KVAL, is to stay home so you don't get other people sick. That costs them money. The most fiscally responsible thing is to stay home. So hopefully your employer will pay you to stay home. Hopefully you have that benefit. And I know that we have laws in place to help secure that for folks. But that is truly the best thing you can do is to isolate yourself and then stay as clean as possible, especially around your family. Try to keep them healthy and safe too.
Awesome. I think that's all my questions. Do we have any deaths in Lane County so far from the flu?
No, not yet. However, I think you know this, Gold, that the flu almost never kills anybody. What kills people is pneumonia. And so typically what happens is someone gets influenza and they get a secondary infection from influenza. They develop a bacterial infection in their lungs and they get bacterial pneumonia. And then their body, in an effort to try and kill that, fills their lungs up with liquid. And then you essentially suffocate, you drown. And a lot of times the problem with pneumonia, especially bacterial pneumonia as a secondary infection, is you feel really tired, you feel really washed out, but it's not like you feel like you're on death's doorstep necessarily. And a lot of times the death happens in your sleep when you're laying down. And so that's where we see the death happens. Typically, that's not something to fearmonger to tell people like it could kill you. So, get the flu shot. It typically happens in people who they have compromised pulmonary systems, so they can't cough up the phlegm and the liquid that's starting to build up in their lungs. Most people don't develop pneumonia after getting the flu. Most people, the infection, your body fights it off, you get better. But in those people that their immune response is not adequate or they have a pulmonary condition, what will happen is that bacteria finds a place to start to proliferate and they develop pneumonia. So I say all that very long-windedly to tell you that there is a possibility we do have a death from the flu, but it's going to be listed on the death certificate as pneumonia.
Ah, got it. And how many cases of flu do we have right now?
We have no idea because it's not a reportable illness. So the way that we track influenza, the way the state does, and then there's two different ways. There's the way the state tracks it, and there's the way we track it. So, and fortunately, the information seems to be lining up between those two entities. So the state tracks it based on emergency room admissions, citing an influenza-like illness or ILI. They also track it based on test positivity rate. So they look at when someone is tested for influenza if it comes back positive. Problem with that is probably 1 in 500 cases is tested. I mean, 95% of people who get influenza stay home, rest, gets lots of fluids. In about 6 days, they feel good enough to go back to normal. They never get tested. We have no idea that they had the flu. It's the person that they give it to who has COPD, who has to be hospitalized, who gets tested. That's who we find out about. So it's just a small subset. It's in no way accurate in terms of an overall number. It's just rates. Now, what we do in Lane County is we have a weekly call with as many of our primary care providers and hospital groups as we can. On that call, we informally poll people. What are you seeing in terms of influenza at your practice? And they tell us, I saw 150 cases last week, or whatever, or it seems to be going down. And we use that information anecdotally to be able to guide our efforts.